Hey guys, welcome back to my channel. So in this episode, I want to touch on a topic that's very serious, and if awareness was improved and intervention was increased, could possibly save many, many lives. This topic is often unspoken about. It's the topic of depression and suicide amongst healthcare workers, and specifically in the field of anesthesiology. Stay tuned. So I've had a really busy week this week with the OR volume just picking back up as we start to do more and more cases that are elective since our COVID shutdown. And I've finally got around to kind of relaxing, and I picked up the latest edition of Anesthesiology News, which I've been meaning to read for a while, and noticed this article which was on anesthesiologists, suicide, and new guidelines that had been formulated. It talks about a study that was done in the United Kingdom, and that study looked at different ways to address the general issue concerning stress in the medical field and how people were coping with stress and some of the outcomes that would be seen as far as rates of death by suicide amongst healthcare workers. And I thought that was very impactful, and that they were able to come up with a new set of strategies to address this one thing that is often overlooked and very frequently, brushed under the rug, I would say, because of the gravity of it. It's not something fun to talk about. It's not something that people really want to face. So I thought that I should make a video to kind of discuss what the article was saying, and also to just bring about, some of the things that we as people in the healthcare field should be aware of, that's present, and that could be something that you could face, once you're a professional. And most importantly, how do you deal with these emotions and stressors in a healthy way? So that was my motivation for doing this type of a topic. Though it's not the most cheerful one, it's one that I think is really relevant and important, and hopefully helps someone that might be going through those types of emotions even right now. Please stay tuned to the end of this video, where I'm going to list some resources that are available to help you or someone else that might be in need of help. So in the article, it states in 2019, there was a UK survey. So the article stated that a 2019 UK survey indicated the need for increasing guidance in managing the risk of death by suicide amongst the anesthesiologists. It also discussed that there were an increase in the general concerns for stress amongst healthcare workers, and how the healthcare workers were not provided ample resources to cope with the stress. So the Association of Anesthetists developed support mechanisms to help individuals and organizations to recognize and prevent anesthesiologists that were at risk of facing suicide. One thing that the article emphasized would be most beneficial in prevention is awareness. And that is something that in doing this video, I wanted to bring to your attention as a viewer, that we're not really made aware of or open in discussing the risk factors that are present, amongst healthcare workers and directly affecting what I do, anesthesiologists and nurse anesthetists. There's a unique risk that's associated with what we do. We're responsible for the very beats of a patient's heart, and it's something that's really stressful, especially in emergency situations. We're there and directly dealing with, patients that are infected with COVID-19. We're at the front lines, intubating, entering rooms when people are trying to exit as quickly as possible. We're inches away from a patient who, is in need of an intubation and is in need of respiratory support. Our faces are inches away from theirs. So we're in a definite space of high stress during this time of pandemic. And that's a vulnerability that, is very unique to this time. So the article pointed out some very specific indications that point to the higher risk amongst anesthesiologists. So there's our access to medications, and potentially lethal ones, and our knowledge of how they work and how they're used. And then again, the particularly stressful environment that can be present in the operating and perioperative period of a patient. And thankfully it's, hasn't been a lingering emotion for me, but personally I felt very much overwhelmed during the peak of the crisis in the New York area. I was always wondering, on a day-to-day basis, is this going to be the interaction? Is this going to be the intubation that will infect me and then potentially infect my family? So it was extremely stressful for me, and I found myself really drawing upon, coping skills that I had developed throughout, my educational training, throughout residency. But at one point, it was not enough. I was very much overwhelmed. And I want to say that it's okay to feel that way. It's okay to express that you feel that way. And it should be encouraged that we express ourselves when we're feeling that way so that we can get help. Initially, when I felt that way, I called my mom. She's my therapist. I called her and I said, I'm really stressed. I'm really feeling like this is too much. And, at that time, we were all quarantined at home. The 3 kids were home, being homeschooled by my husband. And so, there was additional responsibilities for everyone. So I really wasn't going outside of my house to, do anything. And, just coming home from work and just rushing through my decontamination and doing all that so that I could just, interact with my kids. It was a lot, So this is something that I think that if it persisted for a longer period of time, thankfully it did not. Thankfully things became under control, relatively quickly. But I feel like if that persisted, that whole, environment, and this is happening in other parts of the country too, the whole environment of the hospitals being overwhelmed, being full, everyone is working at their ultimate maximum capacity every day. If that's something that persists, can really break down your mental health. As a healthcare provider and someone that is specifically, doing things that are life-saving, like, in critical care and in anesthesiology. So for all healthcare workers, because all of our responsibilities are critical and life-saving in this time, it's really important for you to recognize within yourself, the stressors that are presented. And if you're feeling overwhelmed by them, to seek help, to talk to people, to make it known that, you need time, you need space, you need a break from things so that you can recover and cope. One of the things that was noted as examples for, of people that might be at higher risk for developing depression or might be already depressed and at high risk for suicide. These behaviors were noted in the article. Increased lateness or calling out sick from work was one example. Alteration in your behavior or your appearance from your normal. Fluctuating moods, lashing out or being withdrawn when you're usually more outspoken. And then just noting if there has been an additional significant life event. So some people have lost loved ones to the disease. Some people are going through divorces. Maybe this is a change in their life. They're starting residency or medical school, or, you just started your post-bac program. So a significant change in the style of life you've been living or the demands of your life could precipitate these changes in mental health as well. So this is something that we need to be aware of amongst our colleagues and especially within ourselves, and seek help and address them early on. According to the article published in Missouri Medicine in 2019, Physician Suicide, A Call to Action. Suicide was noted to be the second most common cause of death for 10 to 34-year-olds in the United States. And with the average age of matriculating med students in 2017 to 2018 being 24.9 years old, you can extrapolate that med students, residents, and attendings, like other Americans, are affected by the risk of mental illness and suicide. The article also profoundly stated that in the service of others, physicians often forget to care for themselves and work through illnesses, including mental illness. 20% of medical residents in one study met criteria for depression, while 74% met criteria for burnout, or a triad of exhaustion, depersonalization, and feelings of inefficacy that result from a chronic work-related stress. So other sources have shown that physicians are at high risk for suicide, and those risks begin even before they're done. So in medical school and in residency, the risk of feeling overwhelmed by high demands, competitiveness amongst medical students and residents, lack of sleep, the long hours that you have to put in for studying and caring for patients, and the higher risk for burnout all lead to more concerns for depression and other mental illnesses, and especially for suicide. So it's important for medical schools, hospitals, everywhere that physicians are working and training to create non-judgmental and supportive environments that allow for you to express yourself when you're feeling overwhelmed or stressed, and also support people who are going through depression. We need to destigmatize it. We need to make it something that's easily discussed and easily addressed, and point out the risk factors that are ever present in everyday life when you're taking care of patients and you're working in the healthcare environment. We need to recognize the psychological effects that are associated with taking care of a patient that has a poor outcome, or the death of a patient under someone's care. We need to look out for our colleagues when that occurs. And issues that may be present outside of work, such as personal, financial, or marital problems. So creating a more supportive environment for your colleagues and paying attention to changes and signs that they may be exhibiting could really save a life. Unfortunately, in my experience, I have witnessed devastating effects of mental illness, throughout medical school, residency, and just witnessing actual events of people taking drastic measures to end their lives. This is something that continues to be a prevalent issue, especially in this field. And the ways to improve this, I think, are just increasing the resources that are available to people who might be going through stressful times, and encouraging them to seek out help before it's too late. So a takeaway point that I really wanted to impart to you guys in this video is just bringing to a heightened awareness this problem, and encouraging you to recognize it in yourself. If you're going through training, recognize how you're responding to the stresses of the world and the environment around you as you're going through this really difficult pursuit of medicine, and not ignoring any signs, not feeling embarrassed if you are going through this, because you're not alone. There are so many resources and support networks that are available that you can use to help yourself get through these times. Don't be afraid to ask for help. Don't be afraid to speak out if you think someone else needs help. So with that, I thank you so much for watching. Please don't forget to comment below. Please stay safe and take care of yourself. Until next time, 10 facts about physician suicide and mental health from the American Foundation for Suicide Prevention. 1. Suicide generally is caused by the convergence of multiple risk factors, the most common being untreated or inadequately managed mental health conditions. 2. An estimated 300 physicians die by suicide in the US per year. 3. Physicians who took their lives were less likely to be receiving mental health treatment compared with non-physicians who took their lives, even though depression was found to be a significant risk factor at approximately the same rate in both groups. 4. The suicide rate among male physicians is 1.41 times higher than the general male population, and among female physicians, the relative risk is even more pronounced, 2.27 times greater than the general female population. 5. Suicide is the second leading cause of death in the 24 to 34 age range. Accidents are the first. 6. 28% of residents experience a major depressive episode during training versus 7 to 8% of similarly aged individuals in the US general population. 7. Among physicians, risk for suicide increases when mental health conditions go unaddressed and self-medication occurs as a way to address anxiety, insomnia, or other distressing symptoms. Although self-medicating, mainly with prescription medications, may reduce some symptoms, the underlying health problem is not effectively treated. This can lead to a tragic outcome. 8. In one study, 23% of interns had suicidal thoughts. However, among those interns who completed 4 sessions of web-based cognitive behavioral therapy, suicidal ideation decreased by nearly 50%. 9. Drivers of burnout include workload, work inefficiency, lack of autonomy and meaning in work, and work-home conflict. 10. Unaddressed mental health conditions in the long run are more likely to have a negative impact on a physician's professional reputation and practice than reaching out for help early. You can find this information and more on the American Foundation for Suicide Prevention website, afsp.org.